I'm Dr. Cassie from NABC's Vetfolio and the host of Vet2Vet. Today we're talking about some of the updated information on the management and treatment of cats with chronic kidney disease. More options than ever mean we can work effectively with clients to help improve the quality of life for our CKD patients. Here to talk with us today is internal medicine specialist Dr. Jessica Quimby. With a PhD focusing on feline CKD, Dr. Quimby is now continuing her research as a faculty member at The Ohio State University. Current research areas include the study of renal aging, telomere length and cellular senescence, novel treatment strategies, and evidence-based supportive care strategies. Dr. Quimby, you are certainly the right person to be talking to about cutting-edge treatments for CKD. Thank you so much for joining me today.
It's a pleasure to be here. Thank you very much.
Absolutely. And I love talking kidneys, so I'm really excited for this conversation.
Me too.
Great. So as a GP, I feel like for so long, my management strategy for cats with CKD just seemed to revolve around nutrition and fluid therapy and monitoring BUN and creatinine. But in the last year or two, it seems like we're seeing so many new diagnostics and treatment options that can help manage these patients so much more effectively. So can you tell us about some of the more recent developments around managing kidney disease in cats?
Yes, I definitely say that there has been a lot happening. It's always nice to be part of a field that's, I think, growing rapidly and we're having advances. And I guess when I think about the answer to that question, I would put it into two kind of big categories. Would be we're gaining a better understanding of maybe individualized nutrition plans for our patients and really understanding them on an individual level. And then also, some of the recent research we've been doing has been giving us an idea of the gut-kidney axis and the relationship between GI health and the kidney and what that really means for the patient. Of course, nutrition is a part of that, but there are other aspects to gut-kidney health that actually could be part of our management strategies. So those are two different areas that we've been kind of honing in on.
Very cool. It's especially like the gut kidney connection. I think you called it the gut kidney axis.
Yes.
That's such a neat area of research.
Yeah, it's really something that has grown out of some research from the human side, also looking at different species. Now we're bringing it into veterinary medicine and appreciating that a very similar scenario is happening in our patients. And really what this concept kind of embodies is that the health of the gut does affect the kidney, and the health of the kidney does affect the gut. So as you get kidney disease, you have a lot of toxins that build up in the body. Creatinine and BUN are just two of those that we measure, but we have other things like uremic toxins and indoxyl sulfate. Those substances should be excreted through the kidney. And when they're not, they do build up in the body, and that has deleterious consequences for the body, but then also the gut. It actually makes the gut leakier. It kind of exacerbates the dysbiosis that occurs with chronic kidney disease. And most importantly, it can potentially be a therapeutic target for us. So having a better idea of this relationship between the two. GI disease would then exacerbate kidney disease. Constipation would potentially exacerbate kidney disease. So it kind of goes back and forth. You have this round robin relationship between the two. So if we can treat both aspects of that, it could be more beneficial for our patient in the long run.
Right. Yeah. All of the information that we're learning about the GI tract and how it influences different body systems and just the interconnectedness of all of it is really interesting. I love the idea of having a second endpoint to treat for kidney disease and kind of along those lines of making sure we're taking care of the gut in these CKD patients. How have nutritional recommendations changed in recent years?
Yeah, so when it comes to thinking about nutritional recommendations, again, I would focus on the concept that cats are really individuals when they have chronic kidney disease. We have multiple different stages of chronic kidney disease. Cats all process phosphorus and calcium differently, and they may or may not have elevations in those particular minerals throughout the course of their kidney disease, right? They get what we call CKD, mineral bone disorder, or MBD. CKD MBD is the shortening for it. So magnesium also can become abnormal in those patients. So although traditionally we've looked at the phosphorus on the lab work, and we do absolutely absolutely still do that. The question has been, well, when do we actually phosphorus restrict the patient with kidney disease? What do we do with really early stage kidney disease? And do those patients need phosphorus restriction? We know that's more clear cut when it comes to later stages of kidney disease when the kidney can no longer excrete phosphorus. But this is where some of the new biomarkers that have come out have been helpful. So lots of folks have asked about what do we do with FGF23? And just to give a little bit of background about FGF23, it would be a substance that would start to become elevated as that phosphorus starts to rise in the body and the kidney can no longer compensate by getting rid of that phosphorus into the urine. So FGF23, what we know about it in cats is that in dogs and in general, multi-species, is that it becomes elevated and its job is to increase urinary excretion of phosphorus and then also decrease GI absorption of phosphorus. But at some point in time, you still can't compensate enough. And so that's why we, as veterinarians and as our medical management, we need to then decrease the amount of phosphorus in the diet so that the body does not have to deal with all of that load, right? So we're trying to say, okay, great. There's not as much work for the kidney to do, etc. So FGF23 potentially could be used as a marker to tell us a little bit more of an idea of if we have that really early stage patient, what do we need to do with them? Do they need additional phosphorus restriction at this time, either with food, if that hasn't already been done, or with a phosphate binder? Or do they actually not need this at this stage in their disease?
So, thinking of FGF23, my question with that has been, are we looking for a clinical elevation in the phosphorus on blood work before we're testing FGF23, or are we just going ahead and reaching for
Yeah.
FGF23 and testing that in a patient that we know has even early stage CKD?
Yeah, that's a great question. So for the most part, when phosphorus is already elevated, you don't necessarily need to then reach for the FGF23 because you know that you need to address phosphorus. So if we haven't employed diet, we need to look at that current phosphorus content in the diet and determine what would be a decrease from what the cat is currently eating. And then if we are currently employing diet and we're still not meeting our phosphorus goals, that's when we would reach for phosphate binder. And we have multiple different options available and some new options as well. So traditionally, we've had aluminum hydroxide. We've had various types of calcium-based phosphate binders. We do also use lanthanum, which from the human side, but there's now going to be a feline lanthanum version of phosphate binder that's coming out. So all of those different approaches can provide better control of phosphorus. But the big question still is, does this individual cat need that? So I'm going to reach for the FGF23 when phosphorus is actually normal. And I don't know whether that cat actually needs additional phosphorus restriction. If that FGF23 is really pretty boring, it's below 300. The IRIS website has a little chart for this that can be quite helpful. So if that FGF23 is below 300, that patient we don't see a need to further phosphorus restrict that patient. And the diet that they're currently on may be totally appropriate for their nutritional and medical needs at that time. But if you have that normal phosphorus and the FGF23 is elevated above 400, then that's a patient where we potentially do need to further restrict their phosphorus intake.
Okay. And then, so that would mean that any elevation in blood work on phosphorus, yes, we need to reach for some sort of phosphorus restriction. But
Right.
prior to that, if we have a normal phosphorus on blood work, to know whether or not we need to implement dietary therapy and start restricting phosphorus, that's where FGF23 is going to come into play.
Yeah, exactly, exactly. And that's always been the big question for the past several years is what do we do with these early stage cats? Is there a benefit or a harm to starting them on a very phosphorus restricted diet? And actually, some of the more recent evidence would suggest that if we do overly phosphorus restrict too early, we might actually see an association with then developing hypercalcemia with that. And that's what we don't want to do because, of course, hypercalcemia could put us in a situation where we might be developing stones or mineralization. So we don't want to go there. And so it's important to not use a really phosphorus restricted diet or to be giving a phosphate binder in a patient that maybe doesn't need that in the really early stages of their disease.
I love that we're having this conversation because, yes, this is always this internal battle I have of like, when do we start the kidney diet,
Right.
early versus a regular diet, which one, how do we implement all of this? And it sounds like this gives us a really good marker. And I think part of what kind of creates this inner turmoil when I'm trying to make a decision for these patients is, often these diets are protein restricted. So I'm curious, what was the original rationale behind feeding a protein restricted diet? My understanding was kind of we're restricting protein in order to restrict phosphorus, but that may be kind of an overly simplistic take on these protein restricted diets.
Yeah, that's a good question, and I think I would put it a little bit more complexly than that. First of all, I don't know that I would call them protein restricted because they are above appropriate levels. They're more moderate or modified in protein, and it's very high quality bioavailable proteins. So like the substances that they're getting, they're very careful with the formulation of those diets that they're going to utilize the protein source that they're getting more in that particular diet. So I truthfully, in my mind, I think about the diets being phosphorus restricted, but not necessarily protein restricted. That said, there's a huge range in the protein concentrations available in the diets. And again, that's where my individualized strategy might come out. I might choose something on the slightly, higher side of the renal diets versus the lower end of the renal diets, depending on the specific patient. To answer your question, though, for cats, the story is even more muddy because part of the idea behind that protein modification in dogs, we say it's very much related to proteinuria, but the story for cats there is much less clear. And traditionally, yes, people had said it's hard to restrict phosphorus without also restricting protein, but we don't really seem to be hemmed in by that particular problem anymore. It's newer technology. You can separate those two, and you can actually phosphorus restrict a diet without necessarily protein restricting it. So those no longer have to go hand in hand. Honestly, some of the earliest theories were it was going back to the uremic toxins. So that concept again of the gut-kidney axis is that if we are modifying the protein in the diet and making sure it's not really high protein, we are actually then not providing substrate for the formation of these uremic toxins. So indoxyl sulfate, for instance, comes from the protein catabolism of different amino acids in the colon. So that protein is taken in, it goes to the colon, it's broken down by the gut bacteria, and indoles and cressols are absorbed into the body and they're made into these uremic toxins. So we actually therapeutically, we actually don't have that much information about what dietary strategies do to uremic toxins. We know that if you have really high protein concentrations, there's a correlation with the amount of toxins that might be produced, but we actually don't have a lot of data, especially for our stage 3 and 4 cats. What we do have more data on, and we've been doing some studies in this area, is that you can use adsorbents in the gut to actually bind some of those precursors of the uremic toxins. So that means that you're not absorbing those precursors and they can't be turned into things like indoxyl sulfate that you then struggle to eliminate through the kidney. So we do actually have a unique opportunity, again, thinking about this multimodal strategy between the gut and nutrition, of both picking a nutritional strategy that might help out with this gut-kidney axis and then also targeting those toxins in different ways.
That's so cool. Like just every time I talk about that gut kidney axis and the influence of these renal toxins, because the first time someone said, "Let's talk about renal toxins," I went BUN and creatinine, and no, indoxyl sulfate and these other compounds that you're talking about. That I'm so sorry to my mentor in vet school if he taught me this and I don't remember, but I don't remember learning about these renal toxins in vet school. And it seems like they have such a big impact on the progression of kidney disease. And so being able to then go back and target the gut to help these cats with kidney
Yeah.
disease, it's just this whole new way of treating.
Yeah, yeah. And truthfully, you would not have learned about it when you were in vet school.
That's
I
good.
didn't either. So to be fair, there's approximately, I don't know, I think they say 146, 148 known uremic toxins that many of which have negative effects when they're not excreted by the kidney. And for me, when I first started studying this, we went to a human nephrology conference and there were just literally rows and rows of posters about uremic toxins and how bad they were. And trying to intercede and all the different direct effects on the kidney, effects on the bone, effect on muscle, exacerbating anemia, all of these types of things, and quality of life, very importantly. And I thought, gosh, why do we not know anything about this in veterinary medicine? So that was one of the reasons why we first started studying it. And then looking at, luckily then we're able to have an intervention strategy to be able to employ once again, like I said, we now understand a little bit more about the gut kidney axis. We're of course scraping the surface, but our understanding of this particular area is definitely increasing.
Sure. And, I think we also talked a lot about protein restriction, which I love that you clarified that this is high quality protein. So it's more of a moderate protein diet. But we talked about really paying attention to those protein diets, I think, in vet school. And I think I've heard more and more about we're really having this focus on phosphorus and how important it is to pay attention there. And that's where some of this protein conversation can come from. And the newer technology to kind of separate those two is so cool. But thinking of phosphorus and this bigger focus on making sure that we're moderating the amount of phosphorus in the patients that need it brings me, so then I start thinking about phosphorus binders and I go, oh boy,
Yeah.
aluminum hydroxide and, getting it into the cat and then having them not get GI upset. And, they can be kind of difficult to navigate. So I'm wondering if you can tell us a little bit more about phosphate binders, kind of what's available and what the data says about using the different methods of restricting phosphorus, whether it's phosphorus binders or dietary restriction.
Yeah, so I mean, fortunately, because cats like to change their minds, we do have lots of different products that are available. And there are several calcium-based products out there. There are iron and calcium-based products. The aluminum hydroxide, I think, is one that folks reach for very classically. So lanthanum is one of the newer types. When I say newer, I really mean it's been around for a long time. When we think about the different things, of course, there's always the concern, like you said, about palatability. And so that's, of course, why I always try to start with diet. If I can get them to eat that phosphorus restricted diet and eat it well, using my appetite stimulant, counting calories, weighing them regularly, all of those really important nutritional goals, I'm always going to start with diet and then determine whether I need that additional phosphorus restriction. I do think that's an important point because, of course, it can be a challenge, like you said. And with this concern in cats about hypercalcemia in general, we unfortunately don't have a lot of good studies that let us know how much of a concern using a calcium-based phosphate binder is. And there may be cats who are already hypercalcemic that we wouldn't be able to reach for a calcium-based phosphate binder with the concern that maybe it might actually enhance absorption of calcium. And it could be that it's absolutely not a concern. There just unfortunately is not any really great data out there to say that that's the case. Aluminum hydroxide is aluminum based, and it is not utilized in human medicine anymore because of the concern for aluminum toxicity. However, most of our patients are unlikely to eat enough aluminum hydroxide that there would be a concern for aluminum toxicity. A couple of case reports that have been published, it was when it was fed over with a feeding tube, basically like large amounts of aluminum hydroxide. But sometimes we even then don't achieve our goals. And so if I'm going to reach for one of those medications, it would be lanthanum, which tends to be a more concentrated, it would be more effective than aluminum hydroxide is the main data that we have. And again, like I said, we're now going to have a feline specific product that's available. So we don't necessarily have at this point in time a great deal of experience with that specific product, but lanthanum in general should be very similar. So if I'm struggling to control phosphorus, I would reach for lanthanum. I might add it on to additional phosphate binders that I had in really, really sick patients. Or that might be my best bet if I wanted to concentrate specifically on one. And our experience has been that it's typically better tolerated than the aluminum hydroxide. In Europe, however, they've had lanthanum products for cats actually for a long time in the past and have always had good feedback from that. So it's exciting to have additional options available in the future here.
Absolutely. They're always ahead of us, I tell you.
Yeah. Yeah. So when I talk internationally and they say, "Oh, we have this," and I'm like, "Oh, what do you mean? There's a tasty form of some medication that we haven't got, that, we have jealousy about,
Yeah.
products that don't actually make it into the US." So,
Yes, we'll just have to look from afar and hope, one day that they'll make it our way.
yeah.
Is there, thinking of lanthanum, so is that our option that we should be looking for, if we elect to go with lanthanum as our phosphorus binder?
At the moment, yes. And I actually don't know specifically when the new product will be available. But again, if I had my druthers and you told me I had all the money to pick a phosphate binder and employ it, we would reach for that lanthanum. And again, it can be utilized sometimes in really bad cases. We actually have to utilize multiple different types of phosphate binders because they all work in a slightly different way. And again, sometimes I am limited in my ability to use a calcium-based phosphate binder because we're already fighting a hypercalcemia, in those patients. So if I was going to use that product, I do feel that, given the incidence of hypercalcemia, I should be monitoring ionized calcium to make sure that I'm not encountering a problem.
Sure, sure. Well, it's another option that we can certainly look at because, like you said, sometimes we have to do more to get that phosphorus to come down and
Yeah.
take care of these patients, and we start to run out of options. So it's good to know that there's another category we can look at and reach for, and hopefully, like you said, we'll have more options there in the future.
Yes, yes. And of course, cats, like I said, like to change their minds. So it's good to have a variety of tools in the tool belt, as it were.
Absolutely. Absolutely. Well, Dr. Quimby, I feel like I could just keep sitting here and asking questions because my brain is just going, but what about this? But what about this? But to spare you from that, I'm going to say thank you so much for joining me and for all of the amazing information. Are there any final thoughts you want to share?
I think again, I would just say that, I'm not a nutritionist, of course, but this concept of honing in on nutrition, like you said, it's been the mainstay of our approach for a long time. But the really important part is, of course, getting the calories into the cat, right? And making sure that regardless of what they're eating it well. And that we do really have to come up with this individualized nutrition plan. And that will involve looking at that gut kidney axis and honing that part of their management for them. So again, I do think just on a very, clinical level, there are great opportunities there to look at individual patients and hone their therapy a bit more, for them.
Well, thank you so much again for joining me. This has been a great talk.
Yes, thank you as well. It's a pleasure to be here.
And thank you to DECRA for partnering with us for this edition of Vet2Vet. Check out NAVC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.